Okay, so here's a tough question. She or he asks, I have Graves' disease, can I take your product? And, I will explain what Graves' disease is in a second, but first what I wanted to say is, I'm not your doctor. I might have some nice advice for people, but I'm not your doctor. So please work closely with your doctor. I don't know your situation, and I don't know the extent or the seriousness of your presentation. I don't know your age. I don't know anything about you. I don't know your medical history. So the very first thing to do is to get a proper diagnosis, to work closely with your endocrinologist and your medical team that you trust and know, and that know you. And, her question was that she wanted to know if she has to take prescription. And depending on the level of crisis and what your level of symptoms are, sometimes you can stall a few months if you ask your doctor. So I've seen this with my patients before, where they say, hey, give me 90 days, retest me, let me know how I'm doing, and if I fail miserably, I'll go on the medication. And if I don't fail miserably, if I can improve all my numbers, I can turn my health around in the next 90 days, and when you retest me, I'm looking great or stable, then we can go from there. So how do you do that, though? It takes a huge effort. You'd have to not only take some natural products like the ones I might suggest to you, but you have to take that 90 days on like your life depended on it. And in those 90 days, you have to eat right and exercise and be obsessed with turning your health around and doing everything you possibly can to shock your doctor in 90 days. And that's only if your doctor feels that they can stall 90 days before you go on the meds. And you wake up, watch Rocky, the original movie, and you wake up and you do your day like Rocky and go for it. And maybe you can do it. I don't know. Again, I don't know anything about you, but I've seen it done. I've had patients that do that. And so when they get retested in 90 days with whatever it was, whether it was diabetes or heart disease or high cholesterol or Graves or Hashimoto's, their doctor is like, what have you been doing? These patients in 90 days lost 20 pounds and are fit or jogging every day, and they literally changed their blood chemistry. But now they have to keep earning it. Every 3 months they get tested. They make sure they're not messing everything up and holding the disease at bay with an incredible shift in lifestyle. So if you're that person, go for it. And if you're not, don't be foolish and not be on something that's going to balance your body where you could compromise your health and put yourself into a crisis. So having said that, first I'd tell you what Graves' disease is if you're just checking this out. Graves' disease is an autoimmune condition where your immune system mistakenly attacks your own thyroid, which causes it to become overactive. So this is an overactive thyroid, not an underactive thyroid. The cause of Graves' disease is unknown, but it mostly affects young or middle-aged women and often runs in families. Smoking can also increase your risk of getting it. So there you have it again. Let's say you're smokers and you get a diagnosis with Graves and you're asking me if you could not be on prescription. Quit smoking, get in shape, take it on, and maybe you could be one of those people. My thyroid support would be something you would take if you were stalling, waiting to see if you could make a change, make some, a noticeable shift in your blood work, your blood chemistry. I would take 2 of my thyroid support a day and 2 of my adrenal support today, along with everything else that I mentioned. Get retested in a couple of months if you've earned that time and see how well you could do. Let me know.